Hello everyone. So in this video we will talk about the study of skull. So how can we study skull? So there are 5 ways in which we can study skull. First of all, we can study skull from superior side, posterior side, anterior side. So according to this criteria, there are 5 ways. The first way is superior view. Like we can study skull from the superior view. That's also called norma verticalis. And then second is posterior view, that's also called norma occipitalis. And third is anterior view, that's also called norma frontalis. And next one is lateral view or norma lateralis, and inferior view or norma bassalis. So when we see skull from the superior side or superior view, the shape looks like it's an oval shape, and the posterior side is wider than the interior side, as you can see this in this given diagram. So which bones can be seen in norma verticalis? First of all, the upper part of the frontal bone anteriorly, like from the front, and the uppermost part of the occipital bone posteriorly, and the parietal bone on each side. So next, which are the sutures that we can see from the superior view is the coronal suture, and then sagittal suture, lamboid suture, and metopic suture. We will study in detail about these sutures further. So first of all, the coronal suture. Coronal suture is placed between the frontal bone and the two parietal bones, and this suture crosses the cranial wall from side to side and runs downwards and forwards. And next is sagittal suture, and sagittal suture is placed in the median plane between the two parietal bones, that's on the center. Next one is lamboid suture. Lamboid sutures lie posteriorly between the occipital and the two parietal bones. It runs downward, forward across the cranial vault. So last one is metopic suture. This is occasionally present in about 3 to 8% individuals. It lies in the median plane and separates the two halves of the frontal bone. Normally it fuses at the age of 6. Now we will talk about other features that we can see in superior view. First of all is vertex. Vertex is the highest point on the sagittal suture. Next is vault. Vault of skull is the arched roof. Next term is vault. Vault of skull is the arched roof for the dome of skull. Bregma. Bregma is a meeting point between the coronal and sagittal sutures. In the fetal skull, this is a site of membranous gap called the anterior frontinel, which closes at the 18 months of age, and it allows the growth of the brain. Next is lambda. It's a meeting point between the sagittal and the lamboid sutures. In the fetal skull, it is the site of posterior frontinel, which closes at the age of 2 or 3 months. Next is parietal tuber. Parietal eminence or parietal tuber is the area of maximum convexity of the parietal bone. It is the common site of fracture of the skull. Next term is parietal foramen. The parietal foramen on the each side pierces the parietal bone near its upper border 2.5 to 4 cm in front of the lambda. The parietal foramen transmits an emissary vein from the veins of scalp into superior sagittal sinus. Next term is the oblivion. The oblivion is a point on the sagittal suture between the two parietal foramina. Next is temporal lines. Temporal lines They begin at the zygomatic process of the frontal bone and arches backwards and upwards, crosses the frontal bone and the coronal suture and the parietal bone. Over the parietal bone, there are two lines. So there are two types of temporal lines. First one is superior temporal line and another one is inferior temporal line. They are traced anteriorly. They fuse to form a single line. Traced posteriorly, the superior line fades out over a posterior part of the parietal bone, but the inferior temporal line continues downwards and forwards. Thank you so much for watching.